Assalamu alaikum and good morning to all of you. Today we will start with the non-surgical causes of abdominal pain. Because you already know the surgical causes we approach in such a fashion that we divide the abdomen into quadrants, and according to the location of pain, we decide that how we have to proceed. But as far as the non-surgical causes of abdominal pain are concerned, we should not be forgetful, and we should consider these causes also while we are doing some case regarding abdominal pain. So sometimes a patient with diabetic ketoacidosis can present to you with abdominal pain. Of course, the patient will be not be in a good condition, maybe a shock-like state, increased heart rate, vomiting, shortness of breath. And as far as labs are concerned, you will do the blood sugars, ketone bodies, and pH. So these things will guide you. And then other endocrine causes, the Addison's, which is not very common, but at least you should remember. Then we come to mesenteric ischemia. It is, you can think about mesenteric ischemia or bowel angina in a patient who experiences gut pain or abdominal pain sometime after intake of food. Like shortly after intake of food, these patients generally start experiencing pain. And because these patients can have various types of presentations, like they can be bleeding PR, they can be a spasmodic type of pain, but tenderness is a little bit less, and mostly it is found in elderly patients with peripheral arterial disease, coronary artery disease. And if you dig the history, you can find the history regarding smoking, diabetes, and such things. Then we come to mesenteric adenitis, mostly found in young children, and then we come to porphyria cutanea tarda. PCT, I often forget about PCT, but it is important because it is included in the the non-surgical causes, and also the blistering skin conditions. They include PCT as well. So we should read a little bit about it as well. So there is some decarboxylase enzyme deficiency which leads to accumulation of porphyrins. And the diagnostic test is, of course, a high level of urinary uroporphyrins. So there is some problem with heme metabolism, and there is elevated level of porphyrins in the body, and eventually we find high level of urinary uroporphyrins, right? So clinical findings include photosensitivity reactions, fragile non-healing blisters on sun-exposed parts of the body, such as back of the hands and face. And there can be hyperpigmentation of skin in general, and a thickening of skin of the face, that is called hypertrichosis. And also we can get a triad of abdominal pain, CNS abnormalities, and peripheral neuropathy. And if we dig the history, we have to check about the liver disease. And in liver disease, we can get the history of jaundice, of course, and problems with digestion, jaundice, and all such things. Increase in iron stores, hemochromatosis, hepatitis C, and infections. Everything related to liver disease can be related to porphyria cutanea tarda. Then we come to other causes like HIV, alcohol, women using combined oral contraceptives containing estrogens, diabetes accompanying in 25% of cases. Now, how we manage this case? For the management, we have to stop alcohol, of course, stop estrogen use. We have to use barrier sun protection, because like sunscreens will not protect. So we have to use some clothing, or we have to avoid sunlight to protect from this condition. To remove iron, excess iron from the body, phlebotomy and deferoxamine, and to increase excretion of porphyrins, the anti-malarial chloroquine also helps. But of course, we have to refer, as a family physician, we will refer this condition, but we should be able to take a proper history, and we should be able to differential diagnose this condition from the rest of the blistering skin conditions. Thanking you today, and hope to see you tomorrow for another video.